Have you ever wondered why strokes can happen while sleeping, even when the person maintains a healthy diet and keeps their blood pressure under control? The truth is, your sleeping position, something that seems harmless, can reduce blood flow to the brain by up to 20% within seconds, triggering sleep apnea, atrial fibrillation, AF, and transient ischemic attacks, TIAs, that people over 60 often overlook. I'm Dr. Emily Carter, with over 20 years of experience treating strokes and cardiovascular disease in older adults in the U.S., and today I'll share insights most health videos don't mention: 7 dangerous sleeping positions that increase your risk of stroke, and 5 golden positions to protect your brain, heart, and spine, all backed by scientific studies and real data. One case that made me take this topic seriously was a 68-year-old male patient I treated. He suffered a morning stroke after years of sleeping flat on his back, which his family believed was a safe position. An MRI revealed he had severe undiagnosed obstructive sleep apnea, OSA. By simply changing his sleeping posture, elevating his bed, and following the right treatment, his nighttime oxygen levels improved, and his stroke risk significantly decreased. This story reminds us that familiar habits are often hidden risk factors. Watch this video until the end, because a small change in your sleep position tonight could save your life or that of a loved one. And if you'd like a PDF guide illustrating all safe and unsafe sleeping positions, leave a comment below, and my Senior Health Zone team will send it to you to apply at home. Now let's dive into the most important part of today's video: 7 sleeping positions proven to increase stroke risk in adults over 60. These positions don't just cause discomfort or stiffness. Multiple clinical studies have shown they can disrupt blood flow to the brain, cause oxygen desaturation, trigger atrial fibrillation, and raise nighttime blood pressure, all leading stroke risk factors. The first position is sleeping flat on your back. This position may appear safe, but in reality, it's particularly dangerous for older adults. Studies published in Sleep Medicine revealed that the Apnea-Hypopnea Index, AHI, a measure of sleep apnea severity, doubles when sleeping supine compared to side sleeping. Another study involving over 200 stroke patients found that 71% had OSA, most undiagnosed before their stroke. Sleep apnea doesn't just disrupt sleep. It significantly lowers oxygen saturation, placing extreme stress on the heart and brain overnight. In adults over 60, this condition dramatically increases the risk of early morning ischemic stroke. My advice: if you or a loved one habitually sleeps flat on your back, consider raising the head of your bed by 7.5 to 30 degrees or using a specialized wedge pillow. A 2013 study in Chest found this simple adjustment can reduce sleep apnea severity by 22 to 32%, improve oxygenation, and protect cerebral blood vessels. This is a small change with a big impact that every older adult should start tonight. Next, let's talk about a position many people assume is beneficial, but actually poses serious risks for those with cardiovascular disease: sleeping on your left side. A 2018 study in the Journal of the American College of Cardiology found that 57% of nighttime atrial fibrillation episodes were triggered when patients slept on their left side, compared to only 33% when supine. The mechanism is that this posture shifts the heart forward and to the left, increasing mechanical stress on the pulmonary veins, a common origin of AF. For people over 60, AF isn't just palpitations. It's a top risk factor that increases stroke risk 5-fold. This is especially critical for those with hypertension, diabetes, coronary artery disease, or a history of AF. If you fall into this group, prioritize right-side sleeping or slightly elevating your head to reduce cardiac stress. Consider using a smartwatch or home ECG monitor to track nighttime rhythm changes and catch arrhythmias early. Another position that requires serious caution is prone sleeping with deep neck rotation to one side, a posture that many older adults unknowingly maintain for hours while sleeping. A case report in Spine Journal and multiple MRI Doppler studies have documented that rotating the neck more than 60 degrees while lying prone can reduce vertebral artery blood flow by up to 20%. In older adults with atherosclerosis, carotid artery stenosis, or cervical spine degeneration, this can lead to morning dizziness, transient ischemic attacks, TIAs, or even vertebral artery dissection, a dangerous cause of posterior circulation stroke. Although not common, this condition is extremely serious and often overlooked because patients usually don't feel discomfort during sleep. An effective preventive strategy is to avoid using pillows that are too high or too firm when lying prone. Never rotate the neck to extreme angles, and ideally, eliminate the habit of prone sleeping altogether, especially for those with a history of dizziness, neck or shoulder pain, or cervical spine disorders. Small adjustments like these can significantly reduce the risk of vascular compression and protect brain health. We often assume that curling up tightly in bed brings comfort and security, but for adults over 60, sleeping in a tightly curled fetal position with knees drawn to the chest carries serious health risks. Excessive bending of the torso pushes the diaphragm upward, reducing lung capacity and interfering with oxygen exchange. A study on COPD patients published in Respiratory Medicine found that this posture can lower PaO2 levels by 5 to 10 mg after only a few hours of sleep. Chronic nighttime hypoxia doesn't just cause fatigue and memory decline. It also contributes to nocturnal hypertension and increases the risk of silent brain infarcts, tiny lesions that accumulate over time, laying the groundwork for stroke and dementia. Older adults have a reduced ability to compensate for low oxygen levels, so maintaining this curled-up position night after night places silent strain on the cardiovascular and neurological systems. The safer alternative is to adopt an open fetal position, with knees slightly bent but not tightly drawn to the chest, and to use a body pillow or place a cushion between the knees to maintain comfort without restricting breathing. Another dangerous yet often overlooked posture is side sleeping with the head lower than the heart and an arm under the head. Cervical vein MRI imaging has shown that when the head is positioned about 15 degrees lower than the heart, venous blood return from the brain can drop by up to 20%. Placing the arm under the head adds pressure to the neck and shoulder region, further impairing venous circulation. This can result in morning headaches, facial swelling, and, in severe cases, cerebral venous thrombosis, especially in older adults with dehydration, hypertension, or clotting disorders. This is why many seniors wake up feeling heavy-headed and fatigued despite getting enough sleep. Prevention involves keeping the head level with or slightly above the heart, using a supportive pillow instead of resting on the arm, and selecting a mattress with medium firmness to reduce shoulder and neck pressure. These small changes not only improve cerebral circulation, but also play a critical role in reducing nighttime stroke risk. A common habit many older adults overlook is sleeping on a sofa or recliner. While this position may feel comfortable for watching TV or taking an afternoon nap, sleeping for long periods in a chair bends the legs, keeps the knees higher than the hips, and causes venous blood pooling in the lower extremities. A study published in Thrombosis Research in 2020 found that individuals who slept sitting or reclining for more than 2 hours per night had a 1.5 to 2 times higher risk of deep vein thrombosis, DVT, compared to those who slept in a bed. For adults over 60, the combination of reduced nighttime mobility, dehydration, and cardiovascular conditions further increases the risk of clot formation. If a blood clot travels, it can cause pulmonary embolism or even stroke if it passes through a patent foramen oval in the heart. This is why doctors recommend that seniors limit long sleep sessions in chairs or recliners. If sleeping upright is necessary due to breathing difficulties or lung disease, it's crucial to wear medical compression stockings and perform ankle flexion exercises every 30 minutes to maintain blood flow. Another seemingly harmless but highly dangerous habit is sleeping near the edge of the bed with the head positioned lower than the heart. Many older adults sleep close to one side of the bed for ease of getting up. but this unintentionally increases the risk of orthostatic hypotension and nighttime falls. According to CDC data, 20 to 30% of hemorrhagic strokes in adults over 60 are directly linked to head trauma from nighttime falls. When the head is lower than the heart, the brain receives inaccurate blood pressure signals, making sudden standing even more likely to cause dizziness and imbalance. To reduce these risks, position the bed centrally or slightly away from the wall. Use safety bed rails and motion sensor nightlights for safer nighttime mobility. Elevating the head of the bed by 10 to 15 centimeters, 4 to 6 inches, also helps stabilize blood pressure and reduce orthostatic hypotension when waking up. These small adjustments can prevent one of the leading causes of stroke and death in older adults. Before we move on to the list of safe sleeping positions, I want to share a natural remedy scientifically proven to benefit circulation and brain health. Dandelion root tea. Research from the University of Windsor, Canada, shows that dandelion root extract can selectively eliminate cancer cells without harming healthy cells. It's also rich in polyphenols and flavonoids, which help reduce vascular inflammation and improve circulation. In Western herbal medicine, dandelion has been regarded as a gentle diuretic that supports reducing edema, detoxifying the liver, and protecting blood vessel integrity. For adults over 60, drinking a cup of dandelion tea in the morning or early afternoon may help boost blood flow, lower oxidative stress, and support cardiovascular health. However, it's best to avoid drinking it late at night due to its natural diuretic effect, which can disrupt sleep. Combining optimized sleeping positions with healthy nutrition habits, like drinking dandelion tea, offers a comprehensive approach to protecting brain and heart health. Now, let's explore 5 safe and optimal sleeping positions for adults over 60. The first is sleeping on the right side. This posture helps reduce pressure on the heart and pulmonary veins while improving cerebral blood circulation. A study in the European Journal of Heart Failure found that in patients with heart failure, sleeping on the right side lowered jugular venous pressure and improved breathing rhythm. For seniors with cardiovascular disease or hypertension, this is a highly recommended sleeping position. The second position is left side sleeping, combined with elevating the head of the bed by 7.5 to 30 degrees. Research in the Journal of Clinical Gastroenterology found that sleeping on the left side with the head of the bed raised reduced low esophageal pH time by 71%, meaning it significantly decreases acid reflux symptoms. This is an ideal position for older adults with GERD or frequent nighttime reflux, and it also helps minimize snoring and mild sleep apnea. The third position is called the log position, which means lying on the side with arms and legs extended straight and parallel to the body. This posture helps maintain spinal alignment, reduces disc pressure, and relieves nerve tension. Orthopedic spine specialists recommend this position for individuals with back pain, spinal degeneration, or sciatica, as it reduces spinal twisting forces and preserves the natural curvature of the spine. The fourth position, introduced by NASA and widely adopted in modern sleep medicine, is the zero-gravity position. In this posture, the head and upper body are elevated about 120 degrees relative to the hips, and the legs are slightly raised. This distributes body weight evenly, reduces spinal disc pressure, and promotes venous return to the heart. A study in the Journal of Sleep Medicine demonstrated that the zero-gravity position reduces musculoskeletal stress, improves circulation, and is especially beneficial for people with leg swelling, chronic venous insufficiency, or chronic back pain. Finally, there is the modified soldier position, lying on your back with arms at your sides, the head kept neutral, and a small pillow placed under the knees to slightly elevate them. According to a 2022 study in Spine Journal, using just a thin pillow under the knees can reduce lumbar spine pressure by up to 50%, easing lower back pain and supporting cerebral blood flow. This is the ideal position for individuals who do not suffer from severe OSA or loud snoring but want to maintain a healthy spine. These positions not only help protect cardiovascular and brain health, but also improve sleep quality, reducing the risk of back pain acid reflux, and sleep apnea. The key is to personalize your sleeping posture based on your health condition, combining it with healthy habits such as breathing exercises, a balanced diet, and natural remedies like dandelion tea. A small nightly adjustment can create a profound difference in stroke prevention and longevity. To achieve the highest effectiveness in stroke prevention and cardiovascular health protection, choosing the right sleeping position cannot be done in a one-size-fits-all manner. Every adult over 60 has a unique health profile, and this determines the optimal posture. A meta-analysis from Chest JC and the Journal of Clinical Gastroenterology has confirmed that sleeping posture should be personalized according to underlying health conditions. If you suffer from obstructive sleep apnea, OSA, or heavy snoring, prioritize right-side sleeping combined with elevating the head of the bed by 7.5 to 30 degrees, as a 2013 chest study showed. This simple adjustment can reduce the apnea-hypopnea index, AHI, by 22 to 32% and improve nighttime oxygen saturation. If you have gastroesophageal reflux disease, GERD, a study in the Journal of Clinical Gastroenterology found that sleeping on the left side with an elevated head position can reduce low esophageal pH time by up to 71%, promoting deeper sleep and airway protection. For those with atrial fibrillation, AF, or cardiovascular disease, right-side sleeping reduces mechanical stress on the heart and pulmonary veins, lowering arrhythmia triggers as proven in JC 2018. Patients with COPD, advanced heart failure, or difficulty breathing when lying flat should consider semi-Fowler or zero-gravity positions to improve venous return and reduce pulmonary pressure. And for those with back pain or spinal degeneration, the log position or modified soldier position is recommended for maintaining spinal alignment and significantly decreasing disc pressure. Understanding your health status and applying the correct posture not only enhances sleep quality, but also serves as an effective method for preventing cardiovascular complications and stroke, particularly in seniors. To put this knowledge into action tonight, I've prepared a 5-minute bedtime checklist based on recommendations from leading sleep specialists. First, check your pillows and bed setup. Choose a pillow height of 8 to 10 cm, 3-4 inches, to keep your neck neutral, and if you have reflux or sleep apnea, elevate your bed head by 10 to 15 cm, 4 to 6 inches, rather than stacking pillows to reduce neck strain and keep the airway open. Next, select the correct sleeping position based on your health condition, following the guidelines I've shared to optimize sleep and long-term well-being. Third, prepare a safe sleep environment. Keep the room temperature at 20 to 23 degrees, 68 to 73 degrees Fahrenheit, humidity between 40 and 60%, and ensure motion sensor night lights or soft lighting are in place to reduce fall risk at night. Fourth, if possible, wear a health tracking device like a smartwatch or SpO2 ring to record heart rate and oxygen levels during sleep. This data is invaluable for medical checkups. Finally, dedicate a few minutes to relaxing your nervous system. Practice the 4 to 7 8 breathing technique. Inhale for 4 seconds, hold for 7, exhale for 8, and power down screens at least 1 hour before bed to help your brain enter deep sleep naturally. This 5-minute nightly routine, combined with the right sleeping position, forms the foundation for reducing nighttime stroke risk, improving sleep quality, and protecting memory health in adults over 60. Never underestimate the power of small adjustments. Proper sleep posture is a natural, free, yet incredibly powerful medicine to help you age confidently and healthily. If you want to start protecting your brain, heart, and reducing stroke risk tonight, apply the safe sleeping positions I've shared and follow this 5-minute bedtime checklist to see results within the first week. To make it even easier, I've prepared a free illustrated PDF with all 12 safe and unsafe sleeping positions, plus personalized health-based guidance. Comment "Sleep Safe" below, and the Senior Health Zone team will send it to you today. If you found this content helpful, don't forget to like, subscribe, and turn on notifications so you won't miss future medically accurate videos designed exclusively for adults over 60. I'm Dr. Emily Carter, with over 20 years of experience treating cardiovascular disease, stroke, and sleep disorders in seniors. I believe that lasting health and longevity don't come from expensive interventions, but from small, science-backed changes made in your own home and bed. This video not only provides education, but is a reminder that correct sleeping posture is one of the most natural, safe, and effective methods to prevent stroke in aging adults. Share this video with your loved ones and friends so we can build a community of strong, confident seniors. I'll see you in the next video on Senior Health Zone, where every minute you watch is a step toward a longer, healthier life.